everything is freely supplied by MSSI whenever they ask for it. And since 1997, most important project which Rekha has already told you is to provide physio-occupational therapy at homes of patients. We appoint large number of therapists who can visit 1 or 2 MS patients and provide 1 hour session thrice a week. This is nearly free for many patients and highly subsidized for others. Our maximum funds are utilized for this most beneficial project. Now, I think I should talk about MSSI, and I know people are really interested in listening to Dashpreet. So I will introduce Dr. Dashpreet Kaur, for whom you all are eagerly waiting. I have known Dashpreet for a long time. She is not only highly intelligent and talented, but also a very good human being, which I really like, Dashpreet. She has already conducted 2 free workshops for Mumbai patients and therapists, and also had conducted sessions at other MSSI chapters. She has been continuously uploading videos of physiotherapy exercises on her YouTube channel, which are very, very useful for everyone. Now, proper introduction. Dr. Dashpreet Kaur is a gold medalist both in bachelor's and master's in physiotherapy with additional fellowship in neurological rehabilitation. She is the first physiotherapist worldwide to be awarded prestigious Dupre Grant twice by Multiple Sclerosis International Federation of UK, and also trained in cognitive rehabilitation from France. She is first Indian physiotherapist to undertake a satellite symposium for MS patients at 6th Pan-Asian Committee at Kyoto, Japan. She has presented her research works in many national and international conferences and got many travel grants from everywhere to conduct her special classes there. Dr. Dashpreet owns Bihar's first state-of-art Pilates-based rehabilitation unit in Patna. By attending these online classes, you will be certainly benefited. And so, over to Dashpreet, the main person.
Thank you, ma'am, for your kind words. And okay, I'll quickly just shift on to my slides. Let me start. All right. So I hope my slides are visible to all.
Yes.
Yes. Okay. So at the onset, I would like to thank each one of you who's here. I know if you meet Sheila ma'am once in your life, she's addictive. That's the right word what I use for her. Once you meet her, you cannot sleep without thinking about MS patients. You cannot do your work without thinking about MS patients. And if you happen to do so, she'll pull you back from your regular practice and she'll be like, what happened to my MS patients? Why are you not working for them? So that's the beauty of Sheila ma'am, and that's the beauty of being associated with such lovely organization, Multiple Sclerosis Society of India. And in fact, a lot of things what she has told about my career ever since 2008, apart from the regular physiotherapy thing, I have been, I would say, pushed by her initially, and now I enjoy being on this different path where we take a lot of care, or we think a lot about MS patients. And I'm really lucky or blessed, I would say, that I got a lot of good opportunity to interact with the stalwarts in the field of neurology who've been working for MS patients, especially Professor Peter Faes, Lucine, who are based in Belgium, and Professor Bruno Brochet and Delphine, who are based in Bordeaux, France. So if we talk about multiple sclerosis, I won't talk much in details, because I know all of you who are here, you may be MS patients, the caregiver of MS, or the rehabilitation experts, or even if you are a general public, definitely you are here to understand about this disease, which is quite invisible and it impacts differently to a lot of people. So it is a disabling disease of brain and spinal cord. And signs or symptoms of MS, they vary largely, and it actually depends on the amount of nerve damage and which nerves have been affected. So last year we had a lot of awareness programs about invisible symptoms in MS. So I would say that it's quite surprising, even if you go through Sheila ma'am's history, like she also kept ignoring symptoms of her husband, because most of these symptoms the patient is suffering from it, and unfortunately we are not able to realize that they are suffering from it. So if I talk about rehabilitation, is basically it is a problem solving process, and which is aimed at reducing the disability and the handicap, and it is fundamental for preventing complications. So if you say like I have an MS, can I do without rehabilitation program? Can I do without physical therapy or occupational therapy or speech therapy? My answer is big no. We aim to make you live well for longer. That is basically mantra. How many years you have in your life, it is the quality of life should be really good for you all. Okay, coming on to online classes, that is the new norm now ever since this COVID-19 has hit us all. So basically, online education is nothing but electronically supported learning system which relies on internet for our interaction and distribution of class material. So this my specific talk, it's about our online program, like how we are going to take it up. So one of the main requisites for enrolling in these classes is you should have a stable internet connection. Okay, now there are a couple of questions. I know when we started circulating the flyers for this particular meeting, there must have been lot of concerns. Okay, what are we exactly going to do? What are the aims of these classes? So I have just put up these things in a form of question and answer, and I hope that's going to take care of a lot of your queries. And even if you have anything left over, you can always send us in the chat box or you can email them to us. So, we are starting these online classes because in the past 1 year we realized that a lot of our patients, they missed their therapy sessions, and even it was 1920 has passed, and even in 2021 the fear or the danger of COVID is still hovering around. So we actually do not know when the thing's going to be normal. So now the online pattern of learning is the new normal. So we are trying to adapt that pattern so that in none of the case our patients are left out without therapy. And if I go for like rehabilitation in MS, RIMS is one of the very big organization which have all the rehabilitation personnel who exchange their thoughts, their experiences, their research papers. So if I go by their latest recommendation, they say that delivery of the service must be of high quality, as accessible as possible. It should be continuously adapted to the needs of the person. It should be flexible. It should be timely. It should be evidence and experience based. So, in short, if I say when I started designing these online classes, when I started working with my Belgian group, when I started thinking about what next, how can we really help these patients, these were the basic points which I had borne in mind, like how to go about the whole thing so that we are able to deliver a very uniform service to all our patients pan India. So, the aim of these classes in particular would be to improve your balance and your walking abilities. All right. Now, this is a tricky question. Can all MS patients participate in these classes? As of now, I'm not saying anything to disappoint anyone. As of now, can I put everyone under one umbrella? I would say that will be not correct. Only MS patients satisfying the specific eligibility criteria for this first phase of online classes will be enrolled in. This does not mean those who do not satisfy our eligibility criteria, we are not going to do anything about them. Not at all. This is just a beginning and this is just the phase one. So what is the eligibility criteria? Why we have put the eligibility criteria? Because see, uh, to be very frank, I'm not a big advocate of online therapy, because one-to-one physical interaction with the patients is something which is really important and which helps us to understand the situation much better and much precisely. But considering the prevailing conditions, we somehow have to modify certain things, and we have to be cautious at the same time not to pose any risk to the people for whom this therapy is not made. So that's why we have put an eligibility criteria, which is based on a lot of research papers that I have gone through in past 1 year, why this therapy can be given to this category of people, why they cannot be enrolled. So considering all ifs and buts, we have narrowed down our inclusion criteria. So we all have to remember, one size just does not fit all. See, the therapy that I'm going to talk about, the therapy which I am going to take forward, we are working very specifically to bring about a change in your physical condition. So, for phase one, it is imperative for us to be very selective so that we are able to bring about the results. Okay, I just cannot take each one of you and start giving you therapy without considering your background situation, I would say. Okay, and now, who are eligible for these classes? Those who have their expanded disability range from 1 to 6.5, age 18 to 65 years, and most importantly, those who are able to walk for 6 minutes. Able to walk for 6 minutes means even if you use your walker, you use your cane, not the wheelchair, but if you are able to put your feet on the ground and walk for 6 minutes, you are in for my class. And yes, most importantly, a stable internet connection. So, what is EDSS? If you see very closely, normal neurological examination, no disability, minimal disability, moderate disability. So, we are going to go till 6.5, assistance required to walk. All right. Once you are bound to wheelchair, it will be very difficult to enroll you in the first phase. I would re-emphasize again, in the first phase. We are not leaving you. We are just being very selective in the phase one so that we are able to come out with maybe something better for the other people who have been left in phase one. Okay, so who are not eligible, even if you're able to walk for 6 minutes, then also we have to see you should not be having severe cognitive impairments, no pregnancy, or it should be more than 6 months after you have delivered. You should not have any acute exacerbation of your MS attack, or people, if you are saying you have any other neurological condition which might interfere with your attending these classes, which affect your walking pattern, then also you are not eligible. But this criteria we will screen for you. If you are able to walk, just contact us. We will take care of rest of the things. Okay, now another question. How will these classes be? What will be the focus of the therapy session? Pilates. That is one of my favorite subjects. In 2011, in fact, I got an opportunity to launch my book on Pilates in rehabilitation in Mumbai. So my focus would be on core stabilization. And if you ask me why core stabilization, I simply say the evidence says so. Okay, so this whole program, it is not something which just came into my mind or which I have been practicing over years and now I am just applying it over to you. That is called practice-based evidence. No, as of now, I still feel practicing evidence-based is much better. The things which have already been studied on larger population, which has shown its effect, it's the time that we should start delivering those therapies to you all the therapists who are here, who are listening to me, I would request them, like in the case of multiple sclerosis, let us just try using all the therapies which have been already proven. Maybe we'll be able to add better quality in our patient's life. So, Pilates has received much attention in recent time as a prerequisite for optimal balance control and influencing walking along with your cognition, physical performance, and in posture parameters. So, if you go through the literature, there are lot of good studies, lot of good analysis which says Pilates is quite effective for certain category of MS patients. I'm reinforcing this word, certain categories, the eligibility criteria, because I want to bring about a change. I want all the therapists to work together in one direction, bring about positive changes in our patients, and then all those who have left, we rework on them, find out good therapies for them, and apply it on. So, if I talk about core stabilization and Pilates, it's very important for all of you to understand what are the core muscles. So, in one of my introductory videos, I had introduced you to my friend Skelly, right? So, if I talk about core muscles, it's the muscles right under your liver, lungs. So that makes your diaphragm, and then entire of your pelvic floor that supports all your abdominal content, then your abdomen, then your back muscles, along with all the bony structure, the ligaments, joints, and everything. So that is the core area, the central area of my body. Okay.
Dr. Darshpreet, would you like to stop your share and show it on a larger screen?
Oh no, that's okay. I have slides. I have slides. So I just wanted to introduce Kelly. He's also around. Okay.
Right.
Thank you. Thank you. So now imagine our body to be like a ship. Okay. The base of it is like the pelvic area, the pelvis area. All right. So let me put a body on it. Okay. Now I think it's much easier for all of you to interpret. So just imagine our body. This is the core area, the central area of our body. And we have the diaphragm, we have the abdominals, we have the pelvic floor muscles, we have our spine area, and all right, sorry, I'll go back to this. So, have you just understood which area we are going to concentrate on? This entire big region. This plays a very, very, very important role in giving me a good balance, giving me a good stability, and giving me a good walking pattern. Okay, so how do they provide this? Whatever I'm saying. See, the core muscles, they interact with our ligaments, bones, and the neural control. See, we can never take the head office out. The brain and the spinal cord, they always play a very, very important role in proper management of these things and providing us with a stable system. So if I talk about passive stabilization, that is being provided by bones and ligaments. जो हमारी हड्डियां हैं और उनको जो जोड़ रहे हैं ligaments, वो अपनी जगह पे पड़े हुए हैं, right? Then what happens? My muscles come into action to provide it active stability. अगर मेरे muscles strong होंगे, then only they'll be able to contract well, they'll be able to balance out the forces, and I'll be able to handle my body postures properly. And if my body posture is proper, then only I'll be able to do my work with minimum expenditure of energy. Right? All the MS patients who are listening to me, fatigue is a very, very big problem. We cannot make you exercise beyond a certain extent. We have to take care of your temperatures also. We have to take care of your physical condition also. We have to take care of your body weight also. So, considering all these points together, this core stabilization is one format of exercising which will be able to, not overheat you, which will be enjoyable for you, and it will make this active stabilizing structure more stronger for all of you. Okay, so when this structure works well, I have a good contractions. Now look at this. This is a very, very important function of our core muscles, which we actually don't realize. Can you see the diaphragm? The diaphragm moving up and down. When it goes up, I exhale the air out, and when it goes down, it inhales the air. So if I correlate it to the body system, look at this. The diaphragm going in, and simultaneously it is applying a downward pressure on our pelvic floor. Then it's going up at the time of exhalation. See, this is a very coordinated process which happens all the time in our body. All the time in our body. So that itself is one of the core activity of our body. Okay, so a very simple example to realize what happens to core muscle is, during pregnancy, what happens? Our muscles get overtly stretched to accommodate the growing fetus. So if you see, as the fetus keep growing, it starts pushing over the diaphragm also and the pelvic floor also, which makes a mother susceptible to a lot of incontinence issues, pelvic organ prolapse, and pain. So similarly, as I told you previously, when I talk about core stabilization, it is not just the ligaments part. It is not just the muscular part. It is always also the neural control. So what happens in MS when I have a problem in my brain and spinal cord, this neural control weakens. As a result, this coordinated movement the synchrony tends to reduce. So if we go into any kind of core stabilization process, we are able to get back the synchrony. Is that clear? Why am I aiming on the core stabilization methodology? Okay, so now coming back to our classes, the duration of the class would be about 30 minutes to 45 minutes, and the frequency would be 3 classes per week for 6 weeks. That means just 1.5 months I need of your time to see how well this therapy helps you out. And what will happen in these classes? You've understood that I'm going to focus on your core area. So we are going to follow the protocol suggested by Ian Jeffries. So the exercise program will consist of, first you will learn how to contract your core. Then you will learn how to hold your core muscles, how to hold your transverse abdominis and your pelvic floor muscles, and slowly keep moving your limbs. And then I will make the surface on which you are lying a bit unstable, and then we will ask you to hold the movement. And then we will make the surface also mobile, and we'll add certain resistance. So that is how the progression is going to take place. All the MS patients, don't think I cannot do it. Dare any of you say now, ki, this sounds difficult. This is just not difficult. All right. So in week 1, as I said, it will be a 6-week program. You will learn how to hold the abdominal muscle. पेट नहीं खींचना है, सांस नहीं रोकनी है. You have to find out how to contract your abdominal muscles nicely to get a neutral spine, normal corrective spine. I'm not talking about flat spine. जो आप लोग अक्सर घुटने मोड़ते हैं, सीधा spine को flat कर दिया and you are done. No, we are going to find the neutral spine and we will learn how to hold on to our abdominal muscles. Are you interested to see what will happen actually? Yeah? Okay, let me show you. That's your week 1. You will learn how to hold on to your abdominal. That's day 2 in week 1. That's your day 3. All right, so that'll be your classwork for week 1. As we move to week 2, as I told you, that will be static isometric contraction. When I say isometric contraction, the muscle length is not going to change. All right, you're going to keep holding on to your abdominal muscle and you will keep moving your limbs. Let's see what all you'll be doing. Hold your abdominal muscle and keep moving your limb. Day 2. Hold on to your abdominal muscle, contract them, and then keep moving your limbs simultaneously. Day 3, catch hold of anyone in your family and get your crunches going. All right, it looks quite easy. Yes, believe me when I say, because when we are going to work together, everything is going to fall in place. Okay, so moving on to next one. That will be for your week 4. So as I said, week 3, we are going to go for static isometric contraction on an unbalanced surface. So once you have done week 1 and week 2, it's the right time that we change the surface. Hold on to your abdomen muscle and keep moving your limb. All right, that will be your week 3. Going on to week 4, body movement on a static surface. This is a repeat of previous exercise. You'll be applying more force. We'll increase the force this time. These are lunges for more stability. We'll keep challenging our core, abdominals contracted, and we'll keep changing the direction. And then I need a good squat and your upper body moving, abdominals absolutely contracted within the hold. All right, so we are halfway through our classes, more than halfway. All right, week 5, body movement on an unbalanced surface. Let's see. Hold your abdomen tight and keep moving on the ball. Breathing is really very important when you do any kind of core stabilization. Okay, moving on to our last week, that will be resisted dynamic movement in an unstable environment. See, you have to press against the ball with your hand and with your leg, holding your abdominal strong. Walk through on the ball and sit back. Now, since we've got a good control, it's time to add resistance, and voila, we are done. All right. So, are you excited to be part of this program? Come on, send me your replies in the chat box. I want to hear huge yes from all of you. I want to see the energy which I have. I want you also to reciprocate the same amount of energy that yes, we are going to do something for our bodies. Come on, fill my chat box, fill my chat box. All right, now there are certain rules to master these exercises. As I said, now you've understood the core area of your body. Now it is important to understand how these exercises are done. It is very important that we concentrate on each and every movement. It is not just about you've lied down, you've just contracted your abdomen, you just hold your breath and you are going about it. No, you have to concentrate on each and every movement, how each and every muscles you are recruiting, how you are controlling them, how you are localizing your force, you are centralizing your force towards the abdominal area, and how smoothly there is a lift, how smoothly there is a flow of the movement, and how precisely you are doing it. So these are certain key principles. And I would say, like, mental imagery is one of the prime most thing. Why I have shown you these videos, I have shown you to prime your brain to what is going to happen in these classes. There's no point putting surprises, because what happens that all of us talk most about physical fatigue, but there is an entity that's called cognitive fatigue also. So if you don't know what is going to happen, your mind is going to think about it, क्या होगा उसमें, कैसे करेंगे हम, ये कर पाएंगे नहीं कर पाएंगे. So the purpose of showing you the exercise, what is going to happen in the classes, is to prime your mind. This is the direction we are going to follow. This is the way we are going to scale up. These are the things which are required out of you. So that is very important. Mental imagery, imagining the exercises without performing it, actually activates your brain cell and improves your performance. And this is all evidence based. All right. And another very, very important concept is no valsalva. While you are doing any kind of pilates or core stabilization, सांस नहीं रोकना है, जिसे हम कहते हैं ना, दम नहीं निकालना है. I know, unfortunately, most of our MS patients, they suffer from constipation. So, you have to apply a lot of pressure in your abdominal area for evacuation. So, similarly for exercise, कई बार क्या होता है, just to do the exercise, we tend to hold our breath, और जिसे हम कहते हैं दम लगाना. So, no valsalva during any of these exercises. And what equipments are required? You need a yoga mat, या घर पे कोई दरी होगी, any a little cushioned surface, I would say, gym ball that we would be recommending you according to your weight and height, that would be suggested by us, 5 kg resistive disc or a sandbag or a dumbbell or any weight for doing your crunches, then a TheraBand, TheraTube, or a regular elastic that you get from a tailor's shop, and tape for your floor marking. That's it. That is what I need for your 6 weeks exercise program. And how do you enroll for these classes? Number one, you're going to walk for 6 minutes at your home. If you can do it, congratulations, you are eligible. Send me an email at drdpcore@gmail.com. I repeat, drdpcore@gmail.com, and kindly CC it to mssimumbai@gmail.com. All right. So we are going to send you a Google form in which there'll be a couple of questions through which we are going to try to understand you better. Once we are done with that, we will fix a mutual convenient time for the classes, and then we are ready, all set for the classes. And how will I be guided what to do in therapy session? So to understand how the things will keep going forward, first of all, I'm going to make use of Zoom platform, where just like now we'll have one-to-one interaction, and then you are expected to have your caregiver or your therapist around at the time of therapy. Because what happens, core stabilization is it's a very, I wouldn't say a complex thing, but it requires a lot of concentration and understanding. And in initial 1 week, I would say that would be fantastic if you have your therapist around or the caregiver who can understand the things better and can explain it to you there. I would also be there live on the Zoom platform. I'll be watching you performing these exercises. The video would be running side by side. Each and every step would be broken down. How you have to sit on the bed, how you have to lie down, how you have to get up from the sideline position only, how you have to feel your muscle, how to regulate your breath. Each and everything would be told to you. It will be just like, if you have small children at home, how your teachers are teaching your LKG or UKG children. It's going to be step by step by step. I don't want any of you to miss our physical presence. Okay, and each step, don't worry, it will be demonstrated multiple times to ensure that you have understood it. And a day before our classes, we'll be sending you the short video so that you can practice mental imagery. Just keep seeing the exercise, what are we trying to do and how it is being done. Just see, don't perform. Next day when we are going to come live, then we're going to go do it together. Okay. So yes, this is another important question. What if I miss my class? All right, I know if you have your children going to the school, missing classes is not acceptable. So the level of success you achieve will be in direct proportion to the depth of your commitment. But yes, we do realize there can be emergency situations. So for that, you can contact me and WhatsApp me. I'll be sharing a number once you are enrolled for the classes. But please, no good morning messages. We'll keep it very professional, and then we will reschedule your classes. Okay. So we will go about that way. Another question. Are these classes really free? I know Sheila ma'am has told everyone these classes are absolutely free of cost. But we all know nothing comes free of cost. I'm committed to dedicate so much of my time to you all. So obviously I would be expecting something in return. So what I want is your 100% dedication and sincerity. It has taken me a really, really long time to go through the literature. My team had been working a lot. We had been contacting a lot of stalwarts in rehabilitation abroad just to learn what is latest, what best we can give it to our patients. So I want your 100% dedication and sincerity in this program. It's just 1.5 months I'm asking for. Remember, strong walls shake but never collapse. So make your walls strong, make your core really strong. Now on, switch on your focus mode, switch on your motivation and dedication, and please no excuses. Please no excuses. Thank you so much for listening. It was a pleasure. And you can always email me or you can subscribe to my YouTube channel at Bihar Neuro. And we hope together we can all work together to bring about a change. And my special note to all the people who are not directly associated with MS patient, I would say, uh, through this deliverance, you've come to know a lot about multiple sclerosis. This was an initiative by MSSI Mumbai, and I would say whole Multiple Sclerosis Society of India per se, to make people aware of this invisible disease. So I request you all, if you have any person known to you who is suffering from multiple sclerosis, please tell them about this society. Please tell them there have been people who are working for this for more than 35 years. We want to bring about a change. We want the disability to be reduced into their beautiful abilities, and we are all there. Thank you so much, one and all.
Thank you, Dashpreet. There are some questions, so if you could take those. One is that quite a few of our MSPs, they have relapses, So they wanted to know if they have frequent relapses, would they still be a part of your physiotherapy sessions?
If they had a relapse within 2 weeks, 2 weeks before starting their classes, I would not advise these therapy sessions for them.
Okay. And the therapists want to know whether they could actually attend your classes, not as a support of their of the MSPs, but as individual members